second, as if you had neck pain, headaches, and stuff like that. Is that okay? Right? Okay. Scalacci. I'll call you as soon as they tell me. I'll start. Okay. We good to go? Okay. Come on over. I've got Scalacci here. How old are you now? Come here. Let me show you something. Give me a second. And I'm going to tell you guys a little bit of what to do if you guys have, let's say, go ahead and have a seat. Let's say you have neck pain or headaches or something like that. Because a lot of people go through that. I want to start talking about it just real quick, just a little bit. What was your name again?
Scalacci.
Scalacci, okay. And you get neck pains and headaches, right?
Yeah.
Yeah, a lot of them?
Mm.
And it hurts?
Yeah.
Say out, say out. See, he's got pain when I press him here. It hurts, right? Yes.
Yeah.
See? Okay, so what I'm going to do for him now is I'm going to give him something to do here or do something to him so that we can get rid of his headache, okay? All right, Scalacci, come on over here. Just I need you to lie down there for a second, but we're going to lie you down facing up with your head this way, feet that way, face up, okay? Okay. What do you let me know? Okay. Lie down, lie down. Slide down just a little bit. Okay, you're going to slide down. Okay, sorry. All right. So you guys are going to get a towel just like this one. Okay, and you guys are going to fold it lengthwise. And you're going to ask your spouse or your friend or something like that, to help you with this. Now, if I were to ask my wife to help me with my headaches or neck pain that day, I need to make sure that day I'm not fighting with her, I'm not upset at her, or she's not upset at me, because otherwise she's just going to pull my neck. There you go. Feel better now? You're done. So be careful with this, okay? This is a very dangerous move if you give it to your wife. Okay, so what you guys are going to do is you're just going to put it around the neck like this, okay? That's what you guys are going to do. Go ahead and put your head up, okay? So what you guys are going to do is you're just going to hold the tip of this. Once you guys hold the tip, you guys are going to start pulling, but you guys are going to have it to hold it close to the head or the neck. Once you guys start pulling is not the problem. Letting go is the problem, okay? I'm going to explain to you in just a second. You'll see this. Watch this. So I'm going to start pulling. You let me know when it's good, okay? When you feel good with it. Okay. So you're going to grab here. See, I'm pulling him out on the pulpit. I'm pulling him. So up and out, okay? So really, it doesn't hurt much to pull. When somebody has a headache or neck pain, it doesn't hurt to pull. It hurts to let go. Why? If you have a pinched nerve, when you're pulling, you're decompressing. When you let go, you're recompressing. See what I'm saying? So, when you pull, somebody has neck pain, headaches, or whatever it is, you're going to pull, but you have to pull constantly for at least 10 seconds, meaning that you're going to pull and you're going to keep constant traction. Okay? Here we go. Watch this. So we now know that we can pull as hard as we want, and we can pull him out of here. So what we're going to do is we're going to pull enough right there. So as soon as I feel like the body is being pulled, I stop. And now I count to 10. I count from 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 seconds. And then once I start letting go, I'm going to start slowly letting go. slowly. And now let go for completely. And now wait 10 seconds. And then I pull again. Okay? So now the interesting thing about this is that doing this, pulling for 10 seconds, waiting, letting go, waiting 10 seconds and pulling again, it's the exact same thing that my machine at the clinic does, and I charge $300 per therapy. $300 per therapy, and people pay it. Yes, I sure did. So now remember that when you're letting go, you got to let go easy, because otherwise it's going to hurt. Sounds good? Okay. Alrighty. Okay, so we're all set, man. What do you want, a massage now? Thank you. Let's give him a round of applause, because he was hurting and now he's not. Do you have any more pain? No, right?
No.
Okay, good, good. Otherwise, he's going to have one right now. Just messing. Oh, yeah. You want to do their neck too? Okay, so the lower back. Really interesting. I'm going to give you guys something for the lower back. You guys know that sciatica is crazy out there, and people have low back pain. I see you with a cane. Who's this? You? Okay. So interesting. Listen to this. I had a friend of mine goes to Dallas for continuing education over there, a friend of mine. And then he calls me from Dallas telling me, Lester, I am in excruciating pain. I'm thinking that I'm going to need to go to the hospital. I'm like, Elliot, why don't you go visit some chiropractor out there? I'm in a lot of pain. I think I'm going to go to the hospital. And so I tell him, okay, so you're sitting down most of the time. Yes. Okay, so this is what you're going to do. While you're sitting, you're going to cross your legs like this, okay? You're going to pull yourself forward in the seat, and you're going to push down on that knee that you're crossing, okay? So you're going to push down on the knee, and then you're going to bend towards the knee and look up. Try it. Try it there. Everybody, try it out. And you'll see. Once you push down on the knee, bend towards the knee and look up. It hurts the buttocks area, doesn't it? You feel the pull in the buttocks area. So what you're going to do, you're going to do the exact same thing you did on the neck, but on the knees. What you're going to do is you're going to push down on the knee, bend towards the knee, look up, and wait 10 seconds. And then relax and do it on the other side. Okay? And repeat. He would repeat it every hour. He would do it 3 times on each side. After that day, he didn't even have to go to the hospital. When he came back, he didn't even have to come and see me. Interesting, though. Something that we use at the clinic that is absolutely amazing. Flaxseed. Flaxseed. And a lot of people forget that flaxseed is not only to use internally, but it can also be used externally as a poultice. It is awesome. You know that when you go out there and you guys buy some of these creams that are to lower inflammation for your back and aches and stuff, it contains flaxseed oils. Because flaxseed is highly anti-inflammatory. Isn't that awesome? Isn't that amazing? And this is how to do this. I'm going to explain to you right now how to do that poultice. So what you guys are going to do is you're going to use equal parts of seeds to water. So it's going to be a very small amount of water, really. So you got 1 tablespoon of seeds. You're going to add 1 tablespoon of water. You're going to bring it to a quick boil. As soon as it boils, you turn it off. As soon as it simmers, it becomes like a little paste. And that paste, you're going to take it, you're going to put it on your shoulder, your knee, your back, wherever it is you have pain. Voila. Voila. And don't tell anybody, because everybody will start using this, and then nobody will come to my clinic. No, I'm just messing with you guys. You know, that's something that we have that is, you know, really awesome. Something so simple, and it helps a lot. Tell me. Absolutely, she's doing it already. I think they're doing it here at church already. I think you're going to be able to ask. Are there, you guys recording? There we go. There we go. So, you know, these are all simple but absolutely amazing things you guys can do at your own home. Another one that I'm going to give you guys right now. And it is absolutely amazing also. And it is oregano oil. Oregano oil is a must for you guys to have at home. Oregano oil is wonderful for people that have even fungus, like fungus in your toenails and things like that. It eradicates all of it. All of it. But not only it's good for that, it's also an antibacterial. It has antibacterial properties as well. Just similar to garlic. Now, the way you use it is that, let's say, for instance, if you have fungus in your nails, whatever it is, you just add a couple of drops there, you put it along your toenails, use it a couple of days, and within a week, done. Another amazing thing that you can do with oregano. Listen to this. Earaches, children and kids that suffer a lot from earaches, what you guys are going to do is you guys are going to use equal parts of oregano oil to any other oil, like let's say extra virgin olive oil. You're going to put equal parts of it in a little spoon or something. You're going to add a couple of those drops in the ear and then put like a little cotton ball. At nighttime, next day, you'll be a new person. Sometimes you might need a couple of more therapies, a couple more treatments, but you'll be A-okay. Okay? Now, something that a lot of people don't realize is the fact that headaches, listen to this, some headaches, like I was just explaining about how to work with some headaches, but the truth is that some headaches are due to colon problems and issues. A lot of people don't even think, oh my God, how is the colon related to headaches? Yes, it is. The thing is that I give a little story at the clinic and I explain to everyone how important it is to be able to do your deal every day, at least once a day, every day. Some people are just like, I've got patients that don't do that for over a month. 1 month? I'm like, are you developing a baby there or what? You know, and the thing is that they think it's okay. And I'm thinking right here, right now, a couple of people, that they think it's okay to once a week, if any. You know, what I tell them is that, you know, there was this family that suddenly decided to not throw the trash away. And the trash started developing, and more trash started developing, and more, you know, they started eating bananas. They threw the banana peels. And then insects started coming. And when these insects started appearing, what do they think they did? They called the pest control. Really? Pest control? They called pest control. And then the pest control guy came in and started looking and said, oh, we've got American cockroaches, We've got the German ones back there, too. Well, I think you're going to need a concoction of poison here. Yeah, how much is it going to be? Yeah, it's going to be about $350. So, here you go. Here's your bill. So they pay it. They put the pest control thing came and did his thing, and he left, and you're like, wow, that guy is very knowledgeable. Very nice. But a couple of days later, what do you have? Another infestation of cockroaches. Now you have ants, and now they're armed, and they're stronger now. And so, oh my God, what am I going to do? So you call the pest control guy again, and the pest control guy says, those German cockroaches are really strong now. I don't know what we're going to be able to do with those Germans. So I think we're just going to have to, we've done everything we could. And then this other guy comes up, this hillbilly dude is saying, hey, why don't you all just take the trash out? Throw the trash out? What do you know, man? This guy studied I don't know how many years, and you tell me I just throw the trash out? Yeah, just throw the trash out. And you go, oh, what do we have to lose, And they came in and they cleaned the whole thing and threw the trash out. After they throw the trash out, bugs, the German cockroaches, the American cockroaches, all these cockroaches, all these things just disappear. They have nothing to eat, therefore, they disappear. Now, the same analogy I give for us. If we don't throw our trash out, trouble will come up. We'll get some of those German cockroaches inside of you, right? But the thing is that if we take care of the simple things, the complicated things will take care of its own. And I had, one of my biggest problems that I had, and I can show you guys here. Let me see, I have it here. I want to show you real quick. I've spoken to you guys before in the past with regards to the beans and all that stuff. I wanted to ask my wife to come and speak to you guys as well. We've got plenty to talk about. You guys see that? Wait, let me. Yeah. How about this one? That was me. A year ago. Okay? A year ago. Let me see. I had just one recently. I took mine just recently. Let me see if I have it around here. I should have it here. Oh, there it is. Make it bigger. There we go. Can you see this? Okay. You know what I did? I slept. Remember this morning I told you guys that, go away? Oh, 106 over 60. It's very low. I like it like that. I was going through a lot of stress, and then one way to hack that stress down, sleeping. I wasn't sleeping. What else did I do? Remember what else I did? Yeah, true. Yeah. You know what I did? Because I had medication for this. I was taking meds because I have an internal medicine doctor, Dr. Nelson, at our clinic, and I spoke to him, and he gave me Klonopin. He also gave me Sinopril. He gave me a bunch of other stuff. And then with time, my blood pressure was going up, and he said, well, you're going to have to take more. And then he was adding more Klonopin, and he's adding other medication. I'm like, no, I'm not doing this. So then I started doing fasting. You guys are going to be fasting, aren't you? When is it, the 5th? The 5th, right? Do it. How many days are you guys going to fast? No, it's not days, right? Is it days? Hours? Okay, I fasted for 7 days, only water. And then my wife put me to do another one for 5 days, and it went really well. It closed my stomach out. Oh, crazy. But it works absolutely amazing. Fasting is another hack to health. It's quick healing. Quick. You know, I at our clinic, since we have a multiplicity of different things that we're doing, Pastor Merriman, I need to take you over the clinic. You'll see the new stuff, yeah, that we got there. We got a whole new imaging center that we got there now. A new imaging center. But we'll do lunch. We'll do lunch. Always. Yes. So, you know, this is the thing. You know, food ties us up. You know, food is identity. Food is culture. It identifies us, you know. And it is really annoying, let's put it that way, when somebody comes in and tells you you got to quit eating what you're eating. You know, because even now they tell me, you know, if I go and tell someone you got to quit eating meat, they're not going to want that. Absolutely not. I'm not against eating meat. Let me just be clear on that, okay? Just wait until my wife starts talking there. We got a little difference of opinion there. But, look, you're going to see a little bit of professional differences between us. But it's cool. I like it. I like it. We fight a lot here with regards to health and different things. Because she's a nutritionist, and she doesn't like me to say, but she teaches at University of Florida, and I think she's the best. She's the best. Yeah, absolutely. So I want you guys to listen to her, but I'm going to finish up talking a couple of things here. Let me tell you guys something. Look, I'm a chiropractor. I'm not a medical doctor. And since I'm not a medical doctor, I can't give you advice with regards to medication. But you know what? I can give you what I've studied with regards to medication. And I can tell you if they're good or not, if you should or you shouldn't take it. Okay? These are the advices I can give. I can't put a prescription though, but I can give up the advice. All of it. All right? So, all right. So, I'd like to talk to you guys with regards to inflammation. The inflammation is the basis of almost all conditions. And one of the worst conditions that is attacking us is, number one, heart attacks or heart conditions and cancer. Now, all of these, the majority of all of these conditions, they all start with inflammation. All of it. So there has been a lot of studies in other countries, and you see that especially France, you see people eating meat and drinking alcohol, and they are one of the healthiest countries. And people then, what is it about it? My wife will speak a little bit more about it. I'm getting her in trouble. She's looking at me not well, but anyway, it's okay. We'll argue later then after. But anyway, inflammation is the process by which the body protects itself from irritation or trauma. Inflammation can be acute or chronic. And obviously, we're here because we want to treat chronic inflammation. One of the interesting things that we also do at the clinic is we're about to start doing treating with oxygen. Treating with oxygen. And we're planning on next having a what do you call this, a hyperbaric oxygen chamber at the clinic. And just the fact that you guys breathe, doing a lot of breathing exercises, is one of the main things that I did to lower my blood pressure also. Breathing exercises. Because breathing actually brings down. Is it raining? It sounds like it's raining a lot, right? Yeah, it's pouring. Yeah. So breathing actually brings down your anxiety levels and your stress levels. But you have to learn how to do it correctly, okay? All right. Want to practice with me a little bit? All right. So when you breathe in, you got to breathe in and wait around 10 seconds, 10 to 15 seconds. Can you guys hold your breath for about 10 seconds? Okay? And then, okay, so let's do this. Hold it. And then 1, 2. And now let it go slowly. Okay, hold it there, down there. And now breathe in again. Hold it. Did you feel calmer? Maybe. Let me tell you. One thing I did to show this experiment, I had someone lying down here. I took his blood pressure, and then once I took the blood pressure, lying down, 5 minutes, breathing in, breathing out, I took the blood pressure almost 20 points down. And that is very significant. That is a lot. A lot. Okay? So, inflammation. We're here to work with chronic inflammation, not with this one is not working anymore. The battery left. It's not. You get the battery here? I got it. I'll take it over here. Yeah, go to the next slide for me, please. Okay, another sign of inflammation is, or signs of inflammation are basically the colors. When you guys see colors like red means inflammation. When you touch it, when you touch anything, it means inflammation. If there is swelling, there is inflammation. If there is pain, there is inflammation. Now, another inflammatory process also is people, they've said that when you have all of these 4, or just 2, or just 1, it's inflammation. Okay? You got it? Okay. So, signs of inflammation can be easily mistaken for a sign for something that is some problem in there. Let's say, for instance, if you have pain, the problem is not at your wrist. The problem is not at the knee. So it is actually internal inflammation. I've had people, thank you very much. I've had people that come to the clinic, and then when I put him on an anti-inflammatory diet, a lot of the symptoms, pain in the knee, pain in the neck, in the back, all gone. All gone, okay? But it is if you guys do an anti-inflammatory diet, and we're going to go over that. What? You remember that one? You remember that one? Anything and everything is itis? Yeah, because just by looking at this just gets me, colitis, tonsillitis, vasculitis, pancreatitis, gastritis. I get sick by reading all of these alone, right? Autoimmune conditions. The reason why I have these up here is because autoimmune conditions also start as a pro-inflammatory condition. They are pro-inflammatory. And let me tell you, anything that ends in itis is an inflammation. These conditions, which is irritable bowel syndrome, IBS, Crohn's disease, ulcerative colitis, these are all autoimmune conditions. They all begin as a pro-inflammatory condition. Okay? So if we get ourselves on an anti-inflammatory diet, most of these conditions you can say goodbye to all of them. Okay? When I was a professor at Daytona State College, I had 2 students that came up to me and said, Dr. Carrero, we have Crohn's disease and irritable bowel syndrome. They started setting themselves up in a 2-week anti-inflammatory diet, and within those 2 weeks, their symptoms were all gone. Okay? Now, you guys remember this guy, right? You guys remember him? Who's that? Right. Do we want the Grinch in our house or not? Absolutely not. So, when we eat an orange, look for an orange to see if you have orange. Oranges contain mostly what kind of vitamins? Vitamin C. Does it mean that when you eat an orange, it'll only have vitamin C? No, it means that it contains the most vitamin C. Therefore,